name is Bryaion헌터, and I'm the country director for Save the Children's programs in Nepal and Bhutan. In Nepal, I've been in Nepal for about a year and a half now. I've been working with Save the Children for the past 9 years. Previously I'd worked in Nicaragua and other Latin American countries. This is my first experience working in Nepal, my first experience working in Asia. It's a fascinating place. It's a lovely place, full of dedicated professionals that are working together with me. We have a team of over 200 staff that work hard for Save the Children and for the same goals that we have. It's been an interesting experience for me to change from Latin America, working on some of the same issues, some of the same challenges that children have. In Latin America and in Nepal, there are differences on specific realities for children and challenges in Nepal that I didn't see before, but still, nonetheless, there are a lot of challenges for children. Their right to education and protection and preparation for disasters, reducing their vulnerability in disasters. So some of the similar issues that children face throughout the world are in Nepal. Nepal is a country in which many children are malnourished. The child mortality rate is unacceptably high, and we're working towards reducing that child mortality rate and getting more children into school and safe and protective environments. Nepal is a young country. It's 30 million people, but half of those are children. And many of those children are affected either by health and nutrition problems or lack of access to quality education. Again, similar to many problems that children face in the world, but with some distinctions in Nepal. I think, as you mentioned, Nepal is a picturesque country with a lot of mountains, beautiful place. But one of the challenges is access both to healthcare and to education. Having all of those mountains and difficult access, many children that live in rural communities, villages up in the mountains or in the hills or even in the plains, do not have access to health services. Their mothers, when they're pregnant and when they give birth, 82% actually of births take place in the home without a skilled birth attendant. So children are at risk from the day that they're born. And so the difficult access geographically means that children, when they're born, they don't have the access to services. If there's a problem, if there's an infection at birth, they're vulnerable to dying, actually, in the neonatal period or in the first 5 years of life. If they're sick with diarrheal disease or with pneumonia, sometimes they need access to antibiotics. And they're 2 days walk away from a health post and to getting help. So part of the beauty of Nepal is its rural nature. 80% of the population is living in rural areas, as opposed to Korea, South Korea, where the urban population, percent of population is about 80%. In Nepal, it's about 80% rural population, many inaccessible communities. And that goes for schooling also. Children have to walk hours and days to reach a school that's overcrowded. Teachers, because of the remoteness, don't arrive at school, or the highly motivated, skilled teachers are more in urban areas and not necessarily in rural areas. So that's a challenge. What we do with the sponsorship programs is we support children's education, either early childhood development, basic education, primary school. We support adolescent development, and what we do with adolescents is we support the formation of child clubs where children have a way to to group together and to voice their concerns and to do something about their concerns within the community. We also work in school health and nutrition to make sure that schools have the adequate infrastructure to be able to support quality education for them. Things like building water systems and latrines, and specifically latrines for girls, so girls feel that the school is a safe and protective environment for them. It's interesting, the Adolescent Development Program, there's thousands of child clubs that Save the Children has supported throughout Nepal, and young girls and boys getting together to address problems and voice their concerns. Early childhood marriage is one of the reasons why children, especially girls, drop out of school. 1/3 of all marriages that take place in Nepal involve children. So girls, before they've matured and have a chance to get a full education, are married off. So child clubs are a way in which boys and girls get together and they speak out against those issues, and they protect children, and they make a campaign within their own community to speak out against child marriage, to guarantee that more girls have an opportunity to finish their schooling. Too many children die in Nepal because of preventable causes. Either through pneumonia. Pneumonia kills many children in Nepal. Diarrheal diseases also kill many children. And these things can be prevented. As I said, one of the reasons why there's not access to healthcare is because of the remoteness geographically. And there's been an effort in the last 10 years in Nepal, it's been quite successful, is the training and equipping of female community health volunteers. So when a health post is not available because of the terrain and the geographical conditions, then there are trained health staff supported by the ministry that can detect when a child has a serious illness that needs to be treated through antibiotics, or in the case of diarrheal disease, through oral rehydration treatment. So it's keeping fluids in the body of a young child who is suffering from diarrhea so that they don't dehydrate and die. So female community health volunteers are equipped with either detecting the signs of serious illness and in some cases treating them or referring them to a health post and making sure that children and their mothers get to a health post so that they can be treated for a serious illness or an infection. 안녕하세요. 저는 Save the Children Nepal, 브라이언헌터입니다. 감사합니다. I think I'd like to thank all of the sponsors that support Save the Children in Korea. My message to you is that you're part of the change that we're creating together with others, together with children. Sometimes it's difficult to see the positive outcomes. We always hear about the problems and the continued problems that children face, children dying unnecessarily, children that doesn't have access to school. But what I can say is that through your support, change is happening. More girls are going to school, less children are dying from preventable causes, and you are part of that. With your support, we'll be able to achieve this, and without you, we can't do it. So thank you very much.